Take 193.
Okay, in this film, I'm going to demonstrate how to care for tracheostomy. So before I go into the patient's room, I'm going to check the doctor's orders. I'm going to grab my equipment, check the expiration date, and make sure I have the right patient. So I'm going to knock on the door, I'm going to wash my hands, do all my general safeties and practices, measures, and I'm going to explain the procedure, two patient identifiers, all that stuff. Okay, so I want to first assess the patient. I'm going to assess her respiratory status, her oxygen saturation with the pulse ox, and then her respiratory rate, her effort with the breath sounds. So I'm going to check her lungs. You're sounding much better today, Mrs. Smith. Okay, now that I've done that, she does sound better, so I've already explained to her that I'm going to change out her tracheostomy. So I want to wash my hands again because I didn't know if I did it in the beginning, and I'm going to set her up in in semi-Fowlers, and I'm going to place this chuck across her chest. Okay, and I already got my bio bag there. Okay, so now I'm going to put on my PPE, and I've already got my gown on. I'm going to put my mask on and my goggles. Okay, so I have my trach kit. Set my gloves off to the side. Okay. All right, I'm going to open this away, and I'm going to grab it from the edge. Okay. You just want to stay on the very outer edge and make sure not to contaminate it. This is your sterile field. Okay. And then I'm going to take the bottom of this and dump it out. Okay. And then that's going to be my kit. Okay, so then I would grab my solution without crossing my field, and I want to lip it and then pour it in, lip it again, and then lip it, pour it in, and then I would put my hydrogen peroxide in one spot. Okay, so I'm going to wash my hands, and I'm going to put on some gloves, just regular gloves. Okay, and you want to do your non-dominant hand. You want to secure the faceplate so it doesn't move out, and with your dominant hand, you want to get the what are they called? The ends, the locking mechanism. You want to click it and pull it out. Okay, without going over your sterile field. And then pour it in, put it in the bio bag. Okay, and you want to do that and make sure to stabilize it every time. Get the dressing, and okay. So now you want to take off your gloves. Okay, put that in the garbage. Okay, wash my hands, and now I'm ready to put on my sterile gloves. And you don't want to put your back towards the sterile field. Well. Okay. Well. Be careful not to touch anything. Well, it's not liking me. Well, I could fix it afterwards. Okay, pull them over, then you can fix your hand. These clothes are not the best. Okay, and I'm still not touching it. Okay, so now I'm ready. Put that in the garbage. Alright, so now what I want to do is I want to go in my field. And I want to pre-oxygenate the patient, but I'm going to have to, dang it,